Dr. Peter Glidden, your steadfast advocate for health. Thanks for your time. In the 18th century, medical doctors, before anybody knew anything about the existence of microbes, believed that chronic disease itself, was caused by the accumulation of bad humors in the body, and their treatment was to bleed their patients, eliminating the bad humors. For goodness sakes, that's how George Washington died, by MDs bleeding him, quite frankly, to death. Well, you know, in retrospect, everything makes sense, and these therapeutics today seem juvenile and childish, but I'm here to tell you that history doesn't repeat itself, it rhymes, and that we are in the middle of an epidemic here. And the reason that the epidemic of chronic disease is accelerating, Alzheimer's is getting worse, autism is getting worse, obesity is getting worse, arthritis, type 2 diabetes getting worse, infertility increasing. As a nation, we're getting sicker, we're not getting healthier. We're getting sicker, we're going in the wrong direction. And it's not because of chemtrails, it's not because of electromagnetic radiation from the cell phone, it's because the philosophy of medicine that the MDs are trained in is old-fashioned, juvenile, and quite frankly wrong. The same way that they thought disease was caused by the accumulation of bad humors, and they were wrong, their understanding of the disease process in now the 21st century is also wrong. And let me explain that to you. Now look, your medical doctor may be the nicest person that God ever created, but they only know what they've been trained in. And what they've been trained in is just one piece of the pie of medical science. But the pharmaceutical industry has sold that piece of the pie of medical science to you as the only valid piece. And every other piece is quackery. I say it's just quackery, right? The naturopaths, the homeopaths, the traditional Chinese medical doctors, the acupuncturists, Ayurvedic practitioners, herbalists, we all practice quack medicine, right? That's what Big Pharma has told you for the last 107 years. And by the way, in 1912, through the political pressure and persuasion of the Carnegies and the Rockefellers, Congress in the United States of America granted the American Medical Association exclusive control over who could and who couldn't practice medicine. And they've maintained their hostile takeover position at the top with the unimaginable wealth and political power of the pharmaceutical industry. So since 1912, we have not had a free medical market. You have only had access to MD-directed medicine. And listen, your, again, medical doctor may be a really nice person, but they don't practice medicine. Nobody practices medicine. Medicine is like an umbrella underneath which there hang many different disciplines, or it's like dogs. A lot of different types of dogs, right? And they're all good for different things. Well, the type of medicine that the MDs are trained in is referred to as allopathic medicine. I practice naturopathic medicine. There's homeopathic medicine, chiropractic medicine, osteopathic medicine, Ayurvedic medicine, traditional Chinese medicine, and acupuncture, many different medical disciplines. The MDs are trained and practice allopathic medicine. And my position here is that allopathic medicine, which is the dominant monopolistic force, has been the dominant monopolistic force of the development and the delivery of medicine for the last 107 years, espouses a juvenile, old-fashioned, outdated, incorrect medical philosophy. And, you know, it's more of the same. They've gotten so many things wrong over the years. The halls of conventional medicine, MD-directed allopathic medicine, are littered with the discarded remains of theories that were ultimately proven wrong, and that when they were practiced created lots and lots of pain and suffering. So let me put it in perspective for you here. So get outside of all of this, you know, kind of philosophical mumbo jumbo. So your MD practices allopathic medicine, which is reductionistic, which believes that the body must be controlled. The body doesn't really have any built-in inherent self-healing properties. So when the body exhibits a symptom, it's the doctor's job to suppress that symptom or manage the symptom with a man-made synthetic pharmaceutical agent. And this is not a diatribe against pharmacy. Thank God for insulin. Thank God for lidocaine. And quite frankly, thank God for the sterile technique. It's not the drug, it's how it's used. It's not the gun, it's how it's used. So you go to your MD's office, you have heartburn, and the MD looks at the heartburn as something that's gone haywire in the body. It's stomach acid that's squirting up into the throat. So the idea is to deliver drugs that completely suppress or even eliminate, dramatically reduce the stomach's production of stomach acid. So if there's no acid in the stomach, it can't get up into the throat. Voila, job done, job well done. But as I've talked about in the past, when you suppress the stomach's production of stomach acid, you mess up everything downstream from that. And the digestion in the human being is of maximum importance for overall health. That's how nutrients get into the body, nutrients that help the body regulate and run. I mean, if your automobile runs out of oil or transmission fluid or air in the tires, not a good thing, right? Well, if your body runs out of nutrients, not a good thing. And that's exactly what's going to happen if you mess up the digestive process. So, same patient with heartburn goes to a naturopathic doctor's office, and the naturopathic doctor looks at the heartburn as a symptom of an imbalance. Because the naturopathic philosophy is that the human body has intelligence. The human body knows how to fix itself. The human body wants to fix itself. The human body's trying to fix itself all of the time. So a symptom is seen as a sign by the body that something is wrong and that needs to be attended to. Right? It's like someone lost at sea shooting up a flare. Yeah, I'm over here. Come and find me. So when it comes to heartburn, as I've spoken about before, the first, second, and third things to consider when a patient presents with heartburn are that their stomach acid is weaker than it should be. When hydrochloric acid levels decrease in the stomach below what is normal, a little valve at the top of the stomach opens up and the weak digestive acid squirts up into the throat. It's a warning by the body. It's a flare shot up by the body. The stomach acid's too weak, boys, girls, men, women. Let's fix it. So the first thing that we do is we encourage the patient to eat more salt and to take a really high quality absorbable calcium supplement. Because in order for the stomach to have healthy stomach acid, that's what it needs, salt and calcium. And 9 times out of 10, when we do this, guess what? The heartburn disappears. Because it was merely a symptom of an imbalance. And it's the naturopathic doctor's job in every circumstance to bring the body back into a state of balance. Now, by the way, that's the definition of health. The ability of a living organism to experience symptoms, or to experience stress, rather, and remain in balance, symptom-free, in a state of harmonious equipoise. Say that 10 times fast. So the idea here is that a symptom, whatever it is an indication that something is wrong. It's a flare shot up by the body. This needs to be attended. But when patients bring their bodies riddled with symptoms to the office of an MD, they're given symptom suppressive medication and surgery. Blood pressure isn't cured, it's managed. Depression, anxiety, fibromyalgia, arthritis, diabetes, type 2 diabetes are not cured, they're managed. All of these conditions are managed. Symptoms are swept under the rug and suppressed, and guess what happens when you do that? The underlying conditions which made everything happen in the first place remain unfixed. So things get worse. As time goes by, you get sicker and sicker and sicker, and you need more and more drugs. It's pretty good for the pharmaceutical industry, not so good for you. And this is the deal. Your medical doctor may be the nicest person in the world, but they only know what they've been trained in, and as it turns out, what they've been trained in is only good for trauma care and surgery when it's necessary. And most of the time, it's not. You wouldn't believe the things myself and my colleagues have seen our patients recover from. Again, The allopathic medical philosophy is wrong. There's no way to sugarcoat it. It's incorrect. It's juvenile. It's old-fashioned. It's out of date. The same way that they thought illness was caused by bad humors, that was wrong. This idea that a symptom needs to be suppressed and managed is wrong, and it's harmful and it's dangerous. There is another way. It's science-based, clinically verified, licensed, and regulated. I wrote a book about it. It's called Attempt to Cure. It's a little bit of history, a little bit of philosophy to give you a perspective of where we're at, and also treatment strategies that myself and my colleagues have developed over the last 30, 40 years. Treatment strategies that we have seen be effective for a number of different health conditions. I think I talk about 88 or so, 89, 90, something like that, health conditions in this book. First steps. I outline the first steps that you should take in order to stimulate your body's built-in natural ability to fix itself, because your body's ability to fix itself, as God is my witness, is 1,000 times greater than anybody has led you to believe. So when we come right down to it, if your body is symptomatic, if you're symptomatic, you've got two choices. You can go to an MD's office and you're going to get a pharmaceutical agent that's expensive, synthetic, the intention of which is not to cure the problem, but to manage it. And over time, it's going to get worse. Or you can go a completely different way. Educate yourself about how to stimulate your body's built-in natural ability to fix itself and attempt to cure the condition, for goodness sakes. Knowledge is so much more than power in this regard, ladies and gentlemen. It can literally save lives. And, also reduce a great amount of needless pain and suffering. Check it out. This book is available in paperback format, also in ebook format, and also on my website, glidden.healthcare. I have a robust online self-help health recovery subscription service if you're more of an online person than a book person. In any event, educate yourself, please, about often the simple steps necessary to get your body into the game of healing, and many times for the first time in your life. Thanks again for your time. God willing, and the creek don't rise. I will see you next time. Until then, live long and prosper.